and welcome to this presentation about STIs, everything that you need to know. The purpose of this is that at this point in health class, you should be a master of reproductive anatomy, which are the body parts, and physiology, which is how the body works. So you understand both the male and female reproductive anatomy and physiology. Now you're going to learn how these systems can be damaged by diseases that are passed through sexual contact. Before I move on, we are specifically talking about the reproductive system and what you need to know to keep your reproductive system safe. However, I also wanted you to remember we've spent a lot of time in class talking about the importance of having positive and healthy relationships. Anytime that you are sexually active, intimate, making contact with somebody else's body, you are also putting your emotions and your mental health and well-being at risk. So yes, we worry about your reproductive anatomy very much, and we want you to know about the diseases very much, but sexual contact of any kind, getting close to another person, is also going to cause some issues with your emotional and mental well-being. So please keep that in mind. And of course, we talk about that a lot in class, but I wanted to mention that before we went on into these notes. Okay. Also, fair warning, if you are watching this video at home, it is going to be pretty descriptive of reproductive anatomy and physiology, and it is also going to include some words that might be icky, words like this word that you see here. So please make sure that you have headphones or you have a quiet space to work in. Okay, so on that note, let me talk about a few of those words that might be a little bit scary. One of those words that will be used during this presentation and that you are going to hear around conversations about sexually transmitted infections is genitals. Genitals are the outside parts of the reproductive system. So for example, you know all about the male anatomy. You know all about the female anatomy, but you also understand that a lot of those body parts are inside of the body. Genitals are relating to the body parts that are on the outside of the body. So for females, the outside of the vaginal canal is termed the vulva, and for males on the outside is the penis and the testicles. So those are genitals. Now, when we talk about sexual contact, it can come in a lot of forms. Anal sex is penetration involving the anus. Vaginal sex is penetration involving the vagina. Oral sex is mouth to genital contact. And sexual contact can also be hands to genitals. So when you are having conversations with people about their sexual history, their definition of having sex may be different from yours. So you knowing that diseases can be passed through oral sex, these are questions that you should be asking people before you determine whether or not you will be intimate with them. And again, I can't say enough times, abstinence is the best way to keep your body and your mind healthy. However, we want you to know this information should you choose to be sexually active with somebody. Okay, so again, here's the female anatomy. You should come into this set of notes knowing all about this, and here's the male anatomy, and you can come back to this part of the video for reference. All right, your note sheet, let me zip ahead here. Your note sheet looks like this, okay? Number one on your note sheet is going to be talking about bacterial infections, which are curable with antibiotics. Number two on your worksheet or your note sheet is viral STIs, which are lifelong, and you can treat the symptoms, but they are not curable. And parasitic STIs are curable with creams, ointments, medicines, and that kind of thing. So you didn't necessarily have to write anything from this slide, but I wanted you to understand that STIs come in three categories. Okay, so your sheet should look like this. Number one is bacteria, and then we'll be talking all about those. Number two is viral, we'll be talking about all about those. And at the bottom of your sheet is parasites, and we'll be talking about those. So let's get right into it. Bacterial STIs, under number one, can be cured with antibiotics. By the way, if you're just taking these notes on a piece of paper, that's fine too. All right, so chlamydia is one of the most common STIs that is curable with antibiotics. The symptoms of chlamydia are vaginal or penile discharge. When you hear me say the word discharge, it means that it can be white, yellow, greenish colored discharge that's coming from the urethra. It can be coming from the vagina, and it can also even be coming from the anus. So this is any kind of discharge that's coming out from around your reproductive urinary tract that would warn you that there's something wrong. It can also infect the mouth and the throat. So you can get chlamydia in the mouth and the throat. And the symptoms of that would be sore throat, sores in the mouth, etc. So you are putting these notes into your note sheet here in each box. Okay. Long-term damage to the reproductive organs if this disease goes untreated. So women or men may have problems having babies later in life. So sorry for all the clicking around, but I want to show you one more thing. Remember that these diseases, if they go untreated, a disease that started, it entered the body through the urethra. If it's left unchecked, it could end up doing long-term damage to other parts of the reproductive anatomy. Same thing for females, is that it can end up infecting the uterus. It can end up doing damage and leaving scar tissue in the fallopian tubes, meaning that later in life, a woman that might want to have babies would not be able to. Okay, let me click all the way back to where we were. So, it is passed by contact with the genitals, oral sex, anal sex, or vaginal sex. So anytime you are getting your body parts next to somebody else's body parts, there is danger of passing this disease. And the treatment, of course, is taking antibiotics. So if a person who is sexually active is getting tested regularly, they might identify this disease and they may be able to get rid of it with medication. This is an image of the mouth and chlamydia sores that are found in the mouth. Okay. All right, so gonorrhea is very similar to chlamydia, meaning that you almost don't even need to write anything in the box for gonorrhea if you don't want to, except for that it is very similar to chlamydia. Vaginal penile discharge, burning with urination, can also infect the mouth and throat. It's passed by sexual contact. It's treated with antibiotics, and there's long-term damage to the reproductive organs if it's left untreated. I want to warn you on all of these slides, almost all of them, I do have images of sores or maybe images of the mouth when these diseases get in the mouth. And here's another one of those. This is a disease inside, this is the gonorrhea disease inside of somebody's mouth. So again, these diseases not only affect your reproductive system, but they can also affect your mouth and throat. All right, and then the third bacterial infection is syphilis. Syphilis is unique because it attacks the nervous system. And I know you have a fill in the blank for that on your notes, so let me bold that and underline it for you. It affects the nervous system, and that's what it attacks. It comes in stages: primary, secondary, latent, and tertiary. Symptoms are typical STI symptoms that we've talked about so far: the burning with urination, the discharge, discomfort in that area. But you may also experience possible nervous system issues, meaning that you might notice some twitching. Oops, let's not show up Al Capone yet. Well, why not? Here's Al Capone. And Al Capone actually died from syphilis. So Al Capone, as most of you probably know, was a famous gangster during Prohibition times. And he did die later in life from the disease syphilis that just got to a point where it was not treatable. So again, nervous system issues is the main reason why this ends up taking people's lives later in life, because it attacks your nerves, it attacks your brain. Another sign of syphilis is having a painless ulcer. So you can see I have some images here of what those ulcers look like. They're painless, but they're like big open sores, and those are called chancres. So it's passed by direct contact with a syphilis sore during vaginal, anal, or oral sex. You can find sores on or around the penis, vagina, anus, rectum, on the lips, or in the mouth, and really you can find them all over the body, and the treatment is antibiotics. And again, it's fatal, which means that a person can die if it's not found until these later stages. So again, a person who is having sex should be tested on a regular basis, whether they think they have a disease or not, because they would be able to find a disease early on. And again, all of these symptoms that we've talked about, they do not show up for a long time. So you could have the disease for a very long time, and it could be doing a lot of damage to your body without you knowing that you have it. Okay, and on that note, we are going to go over a little story. Speaking of how people can be active with somebody and not realize that they have acquired an STI from that person. So, little story for you. Cindy has oral sex with Alex. Cindy has chlamydia, but Cindy doesn't know it. She hasn't had any symptoms yet, but she does have chlamydia. Cindy and Alex end up breaking up. So they've had oral sex. Cindy didn't know she had chlamydia, and then they end up breaking up. Alex is making out with Sam, a new person, the next weekend. Sam goes to the doctor with strange sores in the mouth. What happened? So in class, we'll be discussing this, but for you thinking from home, consider Cindy had oral sex with Alex. Cindy had chlamydia. Cindy and Alex break up. As we've talked about in class, having conversations with people about what their sexual history is and having questions or conversations with them about getting tested for STIs, those can be uncomfortable conversations. So Alex is making out with Sam the next weekend thinking, what can you get from just making out with a person? Which would mean that they're probably French kissing, their mouths are probably open, a lot of saliva is being shared. And what you've learned now is that if somebody has chlamydia or other STIs in their mouth, they can pass them to you. So that's just sort of a for instance to make you think as you get older and you start making decisions about intimacy with people, think about really knowing them well and what their sexual history is. Okay, now we're moving on to viral STIs. We'll be talking about HPV. You don't have to write anything down yet. Herpes, and then we'll talk about HIV. So let's start with HPV, human papillomavirus. The most common STI, a very common virus, so common that there is actually a vaccine available for it now that most students currently in middle school have probably had. Human papillomavirus can give you warts on the skin. It can also give you like sores in your mouth and other issues throughout your body. And it doesn't just have consequences on the outside of your reproductive system, like the warts, but it can also do damage to the inside of your reproductive system. For women, it can actually cause cervical cancer, which you know that the cervix is the bottom of the uterus and it's found at the top of the vaginal canal. Sorry about that. I'm just going to keep recording though. So the cervical cancer could definitely affect a woman's health and well-being and length of life, but it could also affect their ability to have babies in the future. So back to HPV. So the symptoms are warts on the skin, and here are examples of what the warts can end up looking like, and those can be are most likely found in the genital area if it's genital warts. Also sores in the mouth, and like I said, it can also cause internal reproductive health issues. It's passed by skin-to-skin contact or sexual contact. So we will get into talking about condoms and protection, but honestly, if somebody has warts or they have the virus in their body and they're about to have a wart, we call that viral shedding. We're going to talk about that with herpes. They could end up passing this virus to you. So the treatment is to freeze or burn off the warts. If you're having internal issues like a lot of scarring on the cervix from HPV, they'll actually go in and they'll burn parts of the cervix off or freeze to get rid of the infected area. So there is no cure for HPV. Once you have it, it's something you have to deal with for your whole life. Same with herpes. Herpes is the HSV virus. You don't have to write this part down, but HSV1 is known as mouth herpes. That affects like 90-some% of the population. HSV2 is genital herpes. And the symptoms of that is blisters. So I'm going to show you this picture quick. These are, when you think blisters that show up on any part of the body. Well, genital herpes means that you end up with blisters around the genital area. So it's passed by being intimate with someone who is experiencing viral shedding or who has an active blister. Viral shedding means that before this blister shows up, the virus is in the skin. After the virus goes away, the virus is still in the skin. So you may not actually see the blister, but it is present in the skin and it can be passed. So the treatment for herpes, like I keep saying, there's no cure for it, but you can get treatments. Creams, ointments can be given to help alleviate pain and discomfort from the actual blister itself, but they can also give medication that will help keep the blisters at bay. And again, this is just a disease that once you have it, you'll be spending the rest of your life monitoring it and treating the symptoms as they come up. All right, and then next is HIV, human immunodeficiency virus. That means that it attacks the immune system, making it deficient. The symptoms really for HIV can be all over the place, but often what people find is that they're getting sick a lot because their immune system has been depleted. They may go to their doctor and their doctor may start running tests. Their doctor might find that their white blood cell count is down, and that would be an indicator that they don't have a lot in their body that's fighting off disease and infection. So it's passed by sharing bodily fluids, blood, semen, vaginal fluids, breast milk, etc. So HIV is a little bit different than what we've been talking about, where you can't pass it in saliva, you can't pass it in sweat, you can't pass it in skin-to-skin contact. There has to be sharing of bodily fluids. And the treatment is medications that will strengthen the immune system. HIV leads to AIDS. So human immunodeficiency virus leads to acquired immunodeficiency syndrome. So AIDS will end up, HIV and AIDS attacks the immune system, and it leads to death from common illnesses like pneumonia, bacterial infections like strep throat, or viral infections like the flu, because your body can't fight it like it was built to do, because there's really not an immune system there. So here's the scary thing about HIV is that once you've been in contact with HIV, it takes 3 to 6 months for that disease to show up on a test. And like I said, the symptoms can be a little bit less obvious. So let's listen to this story. Keep in mind, 3 to 6 months for your body just to tell a test that you have it. Story time. Andy and Trisha are high school sweethearts. They are sexually active. Trisha is on birth control. Trisha is a senior going to college. They decide to break up when summer starts. During her first week at college in August, Trisha has unprotected sexual contact with a boy named Charles. Charles does not know that he has HIV. Trisha is nervous about her contact with Charles and gets tested for STIs, including HIV/AIDS, in September. She is very happy to find out that she didn't have any STIs according to her results. So she was sexually active with Charles in August. It's now September, and she's taking the test. And in November, during Thanksgiving break, so August was when she was in contact with Charles. It's now November. During Thanksgiving break, Trisha and Andy reunite. While they had sex during this time, they decide not to get back together. So this is back to her high school sweetheart. When Andy has a new girlfriend the following April, he gets tested before having any sexual contact with her. What might Andy find out at this time? So think about that for a moment from home. We'll be talking about this in class. But what Andy might find out is he might find out that he tests positive for HIV because he was in sexual contact with Trisha in November. At that point, Trisha thought that she was safe because she had a test in September, but it had not been long enough for the disease to show up in her body for the test to tell her that she had it. And then as time went on, by November, she fully had the disease and fully passed it to Andy. So remember that HIV takes 3 to 6 months to show up in the body. So it's important to teach students this and anybody who is sexually active, because if you have a contact with somebody and they have not been tested and you don't know their sexual history fully, you really need to be careful in the following months to be tested and make sure that you did not acquire HIV. Okay, last topic, parasitic STIs. Fill this in on your notes. Other examples of parasites include fleas on pets or ticks on people. So one parasitic STI is crabs. Most people have heard of this. It's pubic lice. It literally looks like this. They are very similar to lice, a little bit bigger. They're passed by sexual contact, but also by sharing clothes, etc. And it's treated like head lice, shampoos, creams, ointments to get rid of the crabs. And the other parasitic STI is trichomoniasis. Most people don't know that they have it. And the symptoms are similar to a lot of the other ones we've talked about: discharge, pain, and or itching in the vagina, urethra, etc. And there's medication to get rid of it. Parasitic STIs can be treated with medications or with creams or with ointments. So hopefully you're able to answer this essential question, identify the risk of being sexually active by discussing the prevalent symptoms and cures for sexually transmitted infections. So how are they treated? What is the difference between bacterial and viral? At what age can a student at Oak Ridge Public Schools seek treatment for STIs? And where can students get help if they are diagnosed, or even if they're not diagnosed? Medical and emotional help. So hopefully you know that the Teen Health Center is also always a resource for getting educated and for getting tested, and also that your friendly neighborhood health teachers are always here to talk to you and answer questions. And I hope that you found this helpful, but also I hope that this information will stay in your brain to help you keep your body safe and healthy for the rest of your life.